Ladies and gentlemen, and I want to welcome you to the Mind Your Head workshop, a workshop on concussion. Myself, Dr. Marco Caravaggio, I'm a Brain First chiropractor. I will be presenting along with my colleague,
Jonathan Meister. I'm a Canadian-trained athletic therapist, massage therapist, and sport massage therapist.
Great. So we're going to be sharing each some of our own specialties and getting you a lot of great information tonight. I'm going to start. Jonathan's going to take a break, and we'll present some great information tonight. Very helpful for you. So we're going to start the evening by doing a bit of a quiz. So we're going to ask you, I'm actually just going to put up 10 questions, and just as I go through them, try to answer the questions yourself. I won't actually give you the answers right here. As we go along through the workshop, we'll be presenting most of the answers, and most of that should be answered as we go through it and as you get the information. So first question is, how many symptoms are needed to diagnose a concussion? 5, 3, 1, 10. Are men or women more susceptible to getting a concussion? Do good quality helmets prevent a concussion? Is there a genetic susceptibility to getting a concussion? Have experts found the part of the brain where concussion occurs? Who takes the longest to recover from a concussion? A child, an adolescent, or an adult? Can an X-ray, MRI, or CT or other diagnostic imaging diagnose a concussion? Are concussions only caused by a direct impact to the head? What is the only proven treatment for concussion? You can only get a concussion by playing sports or physical activity. So those are the 10 questions to kind of get your head thinking a little bit, and we'll see as we go along. So now we're going to go through what are some of the causes of getting a concussion. So they could be fights, falls, bumps, playground injuries, car crashes, bike accidents, contact sports. So this is the basic global thing. So here's a couple of things, and some of the answers are right here. So note, these are not all sports related, okay? So number one, it could be a car accident, it could be a fall, you could fall back, slip on the ice, any of those kind of things. And the other thing to notice is that not all hits to the head are necessary for a concussion. There are some people who just get a very strong blow to the chest can actually cause whiplash and cause concussion in that way. So they don't even actually have to have your head. Sometimes even a fall to the ground, very impactful, can cause some brain damage as well, okay? So that was some of the first questions answered there. What are some of the symptoms? So these are including these, but they're not limited to these. So some of the things that can happen, very, very common. Headaches is a pretty common one. Temporary loss of consciousness can happen. Confusion or feeling as if you're in a fog, that's a very important one, especially as time goes on, and I'll get into why that's important. Amnesia surrounding the traumatic event. Dizziness or seeing stars. Ringing in the ears, nausea, and vomiting. As I go through my part later on when I talk about the brain and how all of these things connect, you'll see how a lot of this big picture kind of comes together. So you only need one of these persistently to be called a concussion. So only one symptom that's persistent and you already have a concussion. So these are the more delayed type of symptoms that can happen. So concentration and memory complaints, irritability and other personality changes, sensitivity to light and noise, sleep disturbances, psychological adjustment problems and depression, disorders of taste and smell. So these are all longer things, not like from the dramatic impact, but these are things that when the brain is not functioning properly, a lot of this stuff can happen. So symptoms by the categories, just so we can kind of separate things out. Emotional and mood, this is important because a lot of times people will pick this up on you. You might not notice these kind of things, but they might say, well, she's getting upset or angrily, there's a bit of sadness involved, maybe nervousness or anxiousness, more emotional than usual. Sleep is a big one that can be affected, so you can sleep more than usual, tired all the time, or you can sleep less than usual or have difficulty falling asleep. In adults, concussions can often go unattended or missed. Very often it happens. Some of those subtle changes happen, but they don't really know that they don't put two and two together. And especially if it hadn't been in a sport type thing, like it could have been a fall or a bump or banging into somebody or something like that, and they wouldn't put two and two together that they actually had a concussion. In children, these are things, if you're parents and you've had kids in sports and you see, maybe they have got their bell rung or something at one point or another, appearing dazed can be something, listless or tired, crying excessively, that's a pretty big red flag there. A change in their eating or sleeping patterns is important. Lack of interest in the usual activities that the child is normally interested in. Temper tantrums can happen as well. The child can be sad. Loss of new skills, so if the child was able to do certain things with their hands and then all of a sudden they can't do them anymore, or maybe balancing on one foot or some certain game that they may have played that they're not playing as well as they used to, that can be a big indicator. Loss of balance and not paying attention are the big ones as well. So who recovers the slowest? So we have child, adolescents, or adults. Who is the slowest recovery? What they're finding is that adolescents have the slowest recovery. So I have some ideas on this, and I'll talk a little bit about this. There was recently, just came out, I think there was a study on energy drinks and more frequent concussions in high school kids or college kids that were drinking at least 4 to 5 energy drinks a day, and they were showing that they had a much higher tendency to have concussions. So getting into that, I'll be talking about later on what is the state of the brain before the actual concussion happens, and how these things can have a negative effect on the health of the brain, and therefore have a more dramatic effect on them possibly getting a concussion. So I call these the brain unhealthy diets. So if often adolescents, kids, usually they're kind of controlled by their parents and they usually try to eat fairly well, but when you get into high school, university level, studying all the time, drinking energy drinks, crappy diet, a high inflammatory diet, the brain is actually in a very bad situation already from that point. So just a slight knock can cause a big problem. So why are females more likely to suffer a concussion? So that's another answer to one of the questions. Females are more likely to suffer, and the general thinking is that the male, the strength of the male neck is a little bit stronger and has more ability to prevent a whiplash kind of thing. With the female neck often being a little bit longer, the bones being a little more spaced out, and the neck muscles being a little less strong, there's more possibility that from the same amount of impact, their head will do much more movement and cause much more damage to the brain. Are genetics involved? So they are thinking that there is some sort of genetic link in certain families having more susceptibility to concussion. They're not really sure why. Once again, I have my theories on this, that very often a family, they kind of have the, mom and dad are buying the food in the house, and often there's certain families that might not necessarily be having a healthy diet. And an unhealthy diet can cause an inflammatory state in the body and as well in the brain, setting up the brain already in a bad position if they get the knock that could happen. So it might not necessarily be a genetic thing in this case, but I would call this what we call an epigenetic phenomenon, meaning the environment in the house and how the people are eating. And if the whole family has an unhealthy diet, then they would all be more susceptible to having brain damage from the same knock that maybe somebody else with a healthier diet might not have caused as much damage. So when you're dealing with a concussion, you can apply ice, but always be wary that ice is preventing blood flow, and if you're putting that up around your head or on your neck, you want to be careful that you're not doing it for an extended period of time, and there's certain time limits to be doing that on. Try to control your pain, but I would not recommend using painkillers. It's very important you should actually feel your limitations. Your body will set up limitations of pain. If you turn your head and it hurts going that far, if you take a painkiller, you might be doing this, and you could actually be causing tissue damage, and you don't want to do that. So if it's really, really horrible, of course you have to do what you got to do. But if you can tolerate it as much as you can, just let your body set up its limits and just kind of go with the pain, and hopefully, and some of the other things I'll recommend later might help with reducing the pain. So rest is one of the biggest things. Jonathan is going to be going over a lot more of this and how to get back into play and how you should rest your body. Avoid alcohol and drugs at all costs, very important. Do not play contact sports, and get help from a family member or friends, because it's important for you to be supported by other people. So now I'm going to have Jonathan come in. He's going to be talking a bit about how you're going to get back into the play and some of the things you need to do, and the imaging and that kind of stuff, and some of the myths that are surrounding, whether you can find it doing that stuff. Jonathan, come on in.
Okay, let's talk about some trivia about concussions. Now, trivia might actually be a misnomer, because the points themselves are not actually trivial. They're very important for consideration. Firstly, concussions are a functional phenomenon, okay? It's determined by how people function. and Dr. Marco mentioned the signs and symptoms earlier on in this presentation. It's not structural. And when we say not structural, it means very clearly that any kind of imaging, whether it's MRI, CAT scan, X-rays and so forth, will not provide a definitive diagnosis that it's a concussion. What it will do is it will disclose that there's a blood clot, fracture and some structural damage that may be involved. Certainly important, but no radiologist can give a diagnosis that there is a concussion as a result of the readings. The other thing is most concussions do not involve loss of consciousness. Certainly loss of consciousness is indicative, quite possibly, of a more serious scenario. But the truth is, a lot of people, the majority of people who are concussed do not actually experience LOC, as in loss of consciousness. Another interesting point is that the cumulative effect is particularly devastating. So if someone has a concussion, 1, 2, 3 concussions, if they occur in isolation from one another, the damage will be far less, the consequences will be far less than if they occur in close succession. So in actual fact, it's very true that one should be removed from an active situation if one has a suspected concussion, lest successive concussions occur and cause a compound effect. The other very important point is that recovery is not just rest from physical activity, but there should actually be some respite from mental, intellectual activity as well. This we will explore further. So a number of things. If you're concussed, and this is especially very important in the modern age of electronics, one has to, I repeat, one has to avoid electronics, whether it's iPad, iPod, computer games, cell phones, television. They're absolutely prohibited. Physical and cognitive stress. So if I am concussed, I will not participate in physical activity. I will also make sure that intellectually, mentally, I take a break as well. I also have to reduce social interaction. Anyone who has experienced a suspected or diagnosed concussion actually has to avoid social interaction until such time as they recover. The brain actually needs these resources to recover. So all the brain resources that are used for intellectual activity, reading a book, that may be required, for example, studying, doing homework, actually have to be funneled exclusively to recovery of the process of brain recovery. It's absolutely essential. So what we're looking at is a gradual return to school activities, modified class structure, and even deferred homework and deferred tests. So there will be a graduated activity schedule, intellectually as well as physically. And all steps along this graduated process have to be symptom-free before progressing. Return to play, return to learn precedes return to play. I will expand later, but essentially someone who is concussed, the first step has to be an intellectual increase in the activity rather than a physical. Okay, so for example, return to learn, since that's the first component. Initially, rest in a dark room, reduced light and absolutely reduced noise. Period of school absence, and it applies to people throughout the age groups. And slowly increased cognitive activities at home. So if a person is symptom-free for a few days after having been in a dark room, they might graduate to reading a chapter of a book. If that works for a few days, then they might, for example, read something more complex, do some mathematical problems, and so they will progress. If one is in a school situation, you're looking at a gradual return to school, such as a partial day, half day, attend some classes. Increments, maybe 1 day, but progress only to tolerance if the person is symptom-free. Now 1 day, of course, is a very aggressive scenario. For children, it actually has to be 3-4 days if necessary. So 1 day is optimistic, but it is a starting point. The second part is returning to play part 2, where we look at increments between progressions. of at least 2 days. So for example, if I have been put off all kinds of physical activity, I will begin by going for a gentle walk, and possibly a brisk walk a few days later. Then maybe running. Then maybe activity with a team with which I'm involved, but no contact. So there's absolutely a process. It goes together with the cognitive progression as well. But as I mentioned, cognitive changes are initiated before the physical. This template of progression is absolutely essential. And by neglecting it, you may actually cause regression and even possibly permanent damage. Treatment options. You were introduced to Dr. Marco earlier, what I call the Marco magic. He focuses on a number of systems, but primarily the nervous system. My work as an athletic therapist and sport massage therapist, I do focus primarily on the soft tissue, but other areas as well. There are obviously interconnections of the soft tissue with the nervous system, the skeletal system as well. One of the phenomena that may occur from a concussion is a possible compression, not in the macro level, but at a subtle level of the bones of the head, which we call the cranial bones. They do, at a subtle level, move in certain axes of movement. This is what we associate with the craniosacral system. And there's some subtle ways that one can use to recalibrate the movement of the bones. Tight muscles, obviously, muscles always guard when there is something intrinsic at a deeper level happening. And of course, restricted fascia. Fascia being the membranes that surround the muscles and actually often provide that inherent tightness, resistance to movement that is typical of muscles. So in actual fact, Dr. Marco and I, working our respective systems together, provide for a tremendous and comprehensive complementary approach. 2 techniques I'll be talking about. One is called cranial traction, or if you will, unwinding. Now, in front of me, you'll have to imagine a head. And what I'm doing is I'm gently tractioning it and letting the head move in various directions of its own volition. I'm not moving it, I'm following the movements and allowing it to reach its natural equilibrium. And by so doing, various soft tissue systems, fascia, muscle, combined with the nervous system, reach its equilibrium. It's very gentle and it works within the body's own tolerance. And this is something that one could consider early on in the treatment process. An analogy for this would be a telephone receiver, a headpiece, which is attached to a cord attached to the telephone. It's completely knotted. By letting the telephone receiver, the telephone headpiece, dangle, pendulum its way around, torsion, twist, move backwards and forwards, and eventually it settles with the cord in a completely loose state. Essentially, that is what I would be doing with the head and the neck. Neck, fascial release. I alluded to the fascia earlier, the membrane substance that actually surrounds all the muscles at various layers. This tissue often becomes very tense when there's trauma to the body. And what I would need to do is release this tissue when there's resulting tightness as consequent to concussion. Very effective, but possibly uncomfortable because it is more aggressive, and it's used later on in the recovery process. Quite simply, what I'm doing is I'm engaging the tissue. I take up the slack, which is what we call the elastic range, and once I'm at the end field of that, I gently induce a release of the tissue, what we call the plastic range. Very effective. It's a great way of remolding tissue into an ideal position, and is also perfect for all computer jockeys. Thank you.
A little bit, because I'm going to use you as an example in a minute. So, prevention techniques that we can look at. So the first one would be wearing helmets, obviously. Avoiding the head as a primary focal point. So they're getting much better at this. I've seen when they're doing football training in football, they're not getting the athletes to run into it. They're getting more shoulder and other things as the main focus. You really want to take the focus away from the head as the battering ram that you're using. So other thing you can do is optimize your brain health with chiropractic and proper nutrition, and as well as unwinding everything, as well as Jonathan mentioned, prior to potentially getting injured. So that's one of the key things I want to get at. One of the biggest thing that has a factor on how bad an impact will be is how healthy your brain is before that. So in contact sports, learn the proper tackling and leading techniques. So the part about the helmets here, so one of the questions earlier was, can a helmet prevent a concussion? And no, it cannot. So even a properly designed helmet with the best helmet in the world, there's always an inherent problem of inertia. So I'll just go through a little demonstration. So come back here towards me a little bit. So let's pretend Jonathan is the inside of a helmet. Okay, so here's my skull is kind of sitting here. This is all the padding of the helmet. So I'm going to be the brain, and around the brain there's a fluid, a cerebrospinal fluid, which is supposed to protect the brain. The brain is kind of floating in this liquid, and that kind of helps it from the bumps and the bings of our day, sort of thing. So let's say Jonathan and I, he's the helmet in front of me, so we're going maybe at about, a fair clip, and then we get hit. Let's say it's in a football game, so another athlete is going to hit us right in the head right here. So we're moving forward. Jonathan hits the other athlete, so the helmet starts to compress. The padding compresses here. He's been going, let's say, 10 or 15 miles an hour, whatever it is. The brain, even though he stopped, the brain is going to keep moving forward, and it's actually going to hit the inside of the skull here, and then even bounce back and hit the back part. So the crew contra coup, they call it, having damage on the front and the back. So it doesn't matter how well constructed this part is, just the fact that it's moving and I'm moving at that rate, the brain will continue going until it hits a hard subject. So it'll displace all that fluid, it'll hit the front of the skull, and oftentimes go and hit the back of the skull too. So it's an important thing. Good helmet, thank you, Jonathan. Great helmet is important, but it actually does not prevent concussions, but it's very, very important to wear it all the time because it can actually prevent just a lot of just general damage to the head and everything else as well. Very important. So how can chiropractic care help? So the idea is, as I mentioned, strengthening the neck muscles is very, very important. And when you have proper alignment in your spine, your neck muscles can be very, very strong to support and give stability. Sports injuries often damage the alignment and the motion of the spine, which causes nerve stress. Spine. So normally the head person looking that way, these yellow things that you see here, these are actually nerves, and there's nerves that exit between each of the bones in the back that go to control organs and different body parts. So when there's misalignment, for example, if we look here, if I stress this spine laterally like this, we may be stressing these nerves, and these nerves will be controlling, let's say, the heart or the lung or some other tissue inside the body. So whenever there's a stress on the spine and the alignment is gone out, it can actually cause spinal nerve stress. In chiropractic, the word we use for that is called a subluxation. That's the big $1 million word. So spinal nerve stress can cause what we call unconscious stress signals that can actually go up to the brain. So there's a term in our physiology what we call proprioception, which means the joints in your body are all sending signals up to your brain, so you know where you are in space. Even if it's pitch black, I'll know if I'm raising two hands, or I know where my body is, because every single joint in your body is sending information up to your brain, and this is called proprioception. When spinal bones have lost their normal movement, they're stuck and they're not moving properly, or they're out of alignment and they're not moving the way they should, that lack of motion actually sends a different signal to your brain, and it's called nociception. So nociception is an unconscious signal of tissue damage. And that actually causes a stress response in the brain and eventually in the body itself. So that's a very important thing. So this often isn't something that you feel, but it has to be addressed. And as Jonathan was saying, it's a functional problem. So it actually each of the bones actually have to be palpated and assessed to see if they're moving properly or not. And that's the job of the chiropractor. So that nociception can cause an overall stress or a fight or flight response. Some people know it as that, and that can actually cause body problems and brain problems. So here's the big $1 million picture of how chiropractic can have a big influence on. Okay, so I'm going to dig in a little closer to this concept here. So we have an input from the chiropractor into the spine. Working on the spine, that'll have an input into the spinal cord. And there's a certain layer of the spinal cord, area 7, which will relay into a number of different parts of the body. This one here is an important one because it goes to something called the sympathetic chain ganglion. So the sympathetic system, if that's harmonized or helped by the one we do our work on the spine, that's the system that would cause that excessive fight or flight. So you want to make sure that that part is balanced. But some of the other connections, some very important things, is as I went through all the different symptoms, there were a lot of things including balance, nausea, vertigo issues, ringing in the ears, a lot of different things like that. So when we have our impact on the spine, that will go up to a part of the brain called the cerebellum. Cerebellum is extremely important for your body's balance, and also how it's connected into the brain. It balances how you learn things, it balances hormones, and a number of other different things. I had a colleague of mine who does the kind of functional neurology work that I do as well. He had a coach, I think, who had gotten into a concussion. He'd been getting worked on by different people for over a year, medications and all different sorts of things. And so, but nothing was working. He's had all these bad symptoms. So my colleague did his first exam on him, and the first test he did, he just got him to put his feet together, looking straight ahead, close his eyes, and all of a sudden this guy was doing this. And my buddy was saying, wow, he's been a whole year of doing all this stuff, and nobody paid any attention to the actual brain function. And just something like that, we know the cerebellum is way off, and there's some specific things we could do on the spine or on the body to actually have an impact on helping the cerebellum become more balanced and create more balance in the brain. So it's a pretty interesting thing. So the other big thing I want to get into is we talked about that global stress response. There's a big axis or a chain of events in your brain that comes from, we call it the hypothalamic pituitary adrenal axis. So what that means is there's a part of your brain called the hypothalamus, which sends signals to your pituitary gland, which is the master controller of all your hormones, and that'll send information down to your adrenal glands, which produce adrenaline, which is our stress hormones. So we need that axis to be working harmoniously and without any stress or interference, and once again, the work that we do can have an impact on that. So as you can see, working on the spine in the proper way can have a big impact on all the different parts of the brain and can have an impact on making the brain healthier. So how can chiropractic care help? So many of you might know the whole story of Sidney Crosby as well. So he had the different concussions. He was going through all the traditional means of getting the regular kind of stuff that most athletes would get. Getting all the different physio and all the different other maybe medications and things. I don't know all the treatments he did, but he was going on that for quite a while. And they'd get a little better, he'd get out on the ice, 1 or 2 hits, and all of a sudden he was back to square one again. And it was only until he finally went to a chiropractic functional neurologist in the United States that actually put his brain back the way it was supposed to make sure it was balanced and working properly, that now we have Sidney Crosby back on the ice and doing great things again. So the functional neurology approach is a very important one. So one of the most important things that we check for, actually, for injury, so when I work with people, it's really good that I can get like a baseline measurement of a lot of these things for athletes before they would actually go out and hypothetically get hit. So I actually run through a little scenario when I get athletes coming to me, and there's actually like an exam form that I do, and I'll go through a number of different screening scenarios. So I'll check their balance and coordination, so I'll get them to stand on one leg, close their eyes, try to touch their nose, and do a bunch of different things that assess the health of the brain and the nervous system. I'll orient them, I'll say, what month is it today? Can you tell me more or less what time it is without looking at your clock? I'll go through a number of different things. I'll go through some memory things. I'm going to read you like 3 or 4 or 5 words, and then maybe in about 10 minutes after I do some other stuff, I say, can you repeat those 5 words back to me again? So this way I can get a baseline measurement of their balance, body-wise, brain function, but also of their cognitive function, because that gets impacted as well. So it's great if I could have this, and then I could always compare it. The parent says, oh, he fell on the ice, or he got hit in the last game. Can you check him again? And I can be able to check and have something to compare from initially. One of the big things we look for, I say the eyes have it. There's something that happens with your eyes. Your eyes are extremely, there's a lot of brain work that needs to control your eyes, to make them move left and right and up and down. It takes a lot of brain activity. And one of the things that we see that oftentimes when athletes get their bell rung, so to speak, their eye function decreases quite drastically. It's a very, very subtle thing, but we can find this stuff. So often when athletes are coming in, I'll be moving this thing in front of their eyes like this. Now there's something called the saccade, where the eyes naturally have a tendency, if you've ever maybe seen somebody in a subway, and they're looking out the window, their eyes are kind of going like this. Because what happens is, as an object moves, the eye will look at it, follow it for a little bit, and then it'll come back again and fixate on another object, and it'll keep doing that. So there'll be this back and forth movement. So I can check that back and forth movement, how healthy it is, by doing this in different directions. So very often a healthy person, their eyes will be very quick and very spontaneous and going back and forth and following and fixating back and forth. After a concussion, or they've had concussion for a while and they've had this kind of thing checked, their eyes are kind of like following it, overshooting, not following it properly. All sorts of things can happen. And a lot of times we do that kind of testing actually for people who eventually, even older people who might be going into Alzheimer's and Parkinson's, a lot of that stuff starts to show up way before they get some of the other symptoms too. So a lot of the discussion we're going through here right now is actually just how can you have a healthy brain, even if you're not into concussion. I'm going through a lot of different valuable information on how you can get a healthy brain in the first place to even prevent things like potentially Parkinson's or brain degeneration, Alzheimer's, and that kind of stuff. So how can we take care of your brain before you get hit? So then once again, that's the most important thing. So in our brain, there's things called neurons. But between all the neurons, there's these cells called glial cells. Glial means glue. So back when I was first in school, many months ago, many years ago, they just thought that that was just like the structure holding stuff together. There's actually more glial cells in your brain than there are neurons, actually, which is interesting. But now they're finding out that these glial cells are actually like the immune system of your brain. So glial cells are very important in the inflammatory response of the brain. There's a big thing here. So what determines the amount of damage from an identical hit? So if we have two people, they get the exact same amount of impact. This person might have a little headache and be dizzy for 1 or 2 days and be fine. This one could be out for weeks or months. Why? Same impact, same amount of damage. Well, what happens is the person that had more lasting damage actually had a weaker brain. So the thing that determines that is what we call how primed the glial cells are before that injury happens. So what can cause this? So it's a very important thing to understand. If I sprain my ankle, it gets red and swollen in my body, but my body has what we call down-regulating things that will actually help the inflammation go down after that's happened. So, you know, you sprain your ankle, you sprain your wrist, or whatever it is, it gets swollen and then slowly the swelling kind of goes away. Unfortunately in the brain really doesn't have those breaks. It actually just continues this cascading event. So the inflammation sticks around for much longer. And usually it'll end up just showing up as brain fog. That's one of the biggest things, because it's important to realize that the brain itself does not have pain receptors. So you don't feel pain in your brain. How it shows up in your life is brain fog, confusion, not knowing where you walk into a room, why did I come here again, and those kind of things. So that's the important part. So we need to understand different things that we can do to impact the glial cells and the inflammatory response of the glial cells in the body, and I'll get into that in a minute. So I'm just going to go through some of the 10 worst foods that will have a bad impact on your body and on your brain as well. So these are the things that you could try to avoid these as much as possible, because a lot of these are neurotoxic. So monosodium glutamate is one of the worst ones that you could find, and there's a lot of different names for that. If you Google synonyms for monosodium glutamate, you'll see so many things that you have no idea that are actually monosodium glutamate hidden. Crazy. Aspartame, so all artificial sweeteners, they're usually all neurotoxic, so avoid those at all costs. High fructose corn syrup is a highly inflammatory, bad thing, and that causes a lot of problems as well. Agave nectar, people thought agave was a good natural, healthy alternative, but it's more fructose. Fructose is a challenging sort of sweetening element. And that's a big, long, complicated story, but we don't want to get into that. But the idea is you don't want so much fructose, and unfortunately agave has more fructose than high fructose corn syrup actually. Artificial food coloring, BHA and BHT, sodium nitrate, all the nitrates in those things, very bad for the brain. Bromate as well. Recombinant bovine growth hormone, where do you find that? Usually in a lot of the dairy products, so try to get organic if you can to avoid that. Refined vegetable oils. So here's another brain tip. Probably the worst thing that causes inflammation in the brain is vegetable oils, polyunsaturated fatty acids, which they've been telling us for the longest time, and those are the things you actually need to be healthy. Very bad. They're awesome when they're inside the vegetable. As soon as you take it outside of the vegetable, all the polyphenols that are inside the vegetable that would normally protect it, they're not there anymore, and it's very high probability that they will become rancid in a very short period of time, and that actually causes body inflammation and brain inflammation. Drugs are another big thing too. All drugs are inflammatory and acidic in the body, and they can all cause a lot of problems with the blood-brain barrier and a number of other things, so you really want to try to keep that to a minimum or avoid it at all costs. So once again, so the diet is very important. So this is how I mentioned that the diet can have a big impact on the brain. And what we actually need, what are they telling us all the time to lose weight? You got to cut out saturated fat and cholesterol. We've been saying that for years, and that probably is the single worst thing that you could be doing for your brain. Your brain, your neurons are actually protected. The thing that makes up your brain and your neurons is actually cholesterol and saturated fat. And your brain has a turnover of fats too. About every 2 to 3 weeks, the fats in your brain need to be turned over or redone. So if you're eating, trans fats and unhealthy fats and vegetable oils, that can actually be causing a worse structure to your neurons. So we actually want to eat healthy fats. What are the healthiest fats? Coconut oil is number one, so you're going to want to get extra virgin organic coconut oil. 2, 3, 4 teaspoons of that a day. Get it in however you can. If you can put it on your salad, some people are putting it in their coffees now. You can put it in your shakes and your smoothies. Another thing you might get, because if you put it in a shake and it's kind of cold, it'll kind of get clumpy. You can get the next thing that is called a medium chain triglyceride, MCT oils. Those are actually liquid at room temperature. You can put those in your shakes and your smoothies as well, and those are all very, very healthy for the brain. Cholesterol, I want you to be getting that mainly from grass-fed butter. There's a company in Canada called Rolling Meadows. That's my favorite one. You want to have lots and lots of butter, as much as you can, on all your vegetables. Be sauteing with it. Just have a lot of butter because that has a lot of great saturated fats and a lot of good cholesterol, but it also has vitamin K2 and a number of other things that aren't found in other things, but it has to be grass-fed butter. You don't want to be getting just the generic butter because grass-fed butter has a lot of different qualities and it's much healthier. You also want to take care of what we call the second brain. This is another big advancement in the last 5 or 10 years. They've been talking about something called the microbiome. The health of your intestine has a big impact on the health of your brain. So a lot of people have been hearing about gluten and gluten sensitivities and leaky gut. You might have been hearing these kind of things. So there's more neurons inside your gut than there are in the rest of your body apparently, and there's 80% of the DNA of your body is actually inside your intestines, found in the bacteria that are inside your gut. Those bacteria are actually responsible for making different, we call them aromatic amino acids. So those are all very important for neurotransmitters and dopamine and serotonin and all the things that are necessary for proper feeling good, all that kind of stuff. So there's a lot of nausea, things that are related for if the gut is off, the brain can be off. If the brain is off, the gut can be off. But one of the big things is if we're having a lot of processed foods, gluten, all of these kind of things can actually cause, if somebody does have a leaky gut, and a lot of things can cause that. It can be like, a lot of processed foods, an inflammatory diet, like gluten-containing foods, grains are a big one, all types of grains. Anything that is genetically modified, those have a big impact on causing a leaky gut. And we're actually finding if you have a leaky gut, meaning things that should stay in your intestines are actually passing into your blood and causing allergic reactions and inflammation. They can also cause a leaky brain as well. And so the brain is getting things going into it that shouldn't be going into it and causing glial cell inflammation and a lot of reactions in that way as well. So it's very important to take care of your intestines. So, good probiotics, fermented foods, as much vegetables as possible, raw foods as much as possible, less cooking. 80% of your plate should be a lot of raw vegetables, and then a good clean protein source if you want to, and very, very little high carbs or processed foods. That's very important. If you've had a concussion, this is going to sound a little controversial, but I'm going to tell you the best anti-inflammatory diet. This is very important, listen up. So this could be a little controversial. Anytime an animal gets hurt, if they get an injury, if they fall, they usually, if an animal is sick, they almost always do one thing: chew a little bit of grass, go lie down and sleep, and they don't eat for days. And they say, well, I got the food for him, he's not eating. All animals know intuitively when you're injured, the last thing you need to do is put food into your system. So the best anti-inflammatory diet is fasting, not putting food into your system for a few days if that's possible. It may sound a little controversial. Everyone says, no, you got to eat to keep your strength up. But in this case, anytime you put food here, massive resources from your body going here to try to digest your food. Lots of blood flow. It's more metabolically demanding. Digesting food is more metabolically demanding than any other process in your body. So you just heard the most important thing is your brain. You want to go nothing. Don't put anything in there except water, some water with maybe some sea salt or Celtic salt, or my favorite is called real salt. 75 minerals in there. Don't use table salt, that's horrible, that's 2 minerals and a bunch of other junk. So a pinch of real salt inside your water, so you're going to be drinking water, keeping yourself hydrated. If you do need to get something in there, like the animals, they actually eat a little bit of grass, so maybe you could do some wheatgrass. You could blend some things, which I'll show you in a minute, some other things that could be coming up, some juices. I'll show some of the other things that might be helpful. And then you might want to consider doing something called a ketogenic diet. So it'd be nice if you kind of had done this prior, but what ketogenic diet means the majority of your ingested foods are actually going to be healthy fats. So avocados, coconut oil, medium-chain triglycerides, butter, saturated fats, grass-fed beef, grass-fed poultry, those kind of things. Just the highest fat foods that you can get, because we want to be feeding our brain, and we want to actually help our brain use ketones, which are different than glucose. Normally your brain it usually likes glucose, but if you go onto a ketogenic diet, and you can look online and try to find there's different sites that talk about this, but it's actually very, very helpful for the brain, and ketones burn very, very efficiently. So I tell people, if you're burning carbohydrates, it's kind of like putting kindling on a fire, and it makes a lot of smoke and there's a lot of byproducts. When you burn ketones, it's almost like natural gas, like on your stove. You turn it on, you turn it off, there's no smoke or anything in the house, it just burns clean. It's very, very efficient and very helpful for the brain. There are lots of studies, and they've been doing this for years in the past. Children that have had epilepsy, they've been putting them on ketogenic diets, and it's been helping the epilepsy because it actually helps restore brain function. It's what the brain could use, and it helps heal the brain. So that's something that could be something interesting to look at as well. So here are some nutritionals that they've actually found that can calm that excessive glial cell inflammation in the brain. So there's a lot here, don't get too scared, I'm going to go through it kind of quickly. So I'll just name each one of them. So this is called apigenin, luteolin, bicolin, resveratrol, rutin, catechins, and curcumin. So I'm not going to go into too much detail, but what the idea is, a lot of these are bioflavonoids. These first three are bioflavonoids. Some of these you could get actually pill form, but one of my recommendations is try to get the actual, eat the actual food that contains these, or juice the food that contains these. So here we're looking at parsley, artichoke, basil, and celery, green peppers and celery, vegetables, or eating the vegetables with maybe a lot of butter, raw grass-fed butter. That would be a good way to get these in if you want to be putting something in your system. Resveratrol, we've known about the whole wine thing. Obviously, we don't want you drinking wine, so you could get that in the capsule form. Rutin, if you're thinking that the white stuff that's on the outside of an orange, the stuff that most people kind of try to get away, if you're maybe, you could eat the orange. I don't want you to juice it, because that'll just be way too much sugar in a blast. So you actually want to eat the orange if you're going to be eating some citrus, but try to get as much as the white stuff on the outside of the orange. Eat as much of that as you can, because that's where the rutin comes from. Catechins, these are polyphenolic antioxidants, plant metabolite, usually found in tea leaves. So in this case, organic green tea would probably be my recommendation if you're going to be drinking your tea. Curcumin, that's the thing that we get in the curry spice. You could be sprinkling that on any of the vegetables that you're eating and try to get that in there, and that can all of these put together can help take down that excessive glial cell inflammation that's going on, that it doesn't have the brakes on its own, so this can help kind of quell that and put the brakes on it. One of my patients who knew we were doing the workshop, he actually sent me an email, and I thought this was an interesting little thing to kind of relay the information. So he said, great topic, especially in the recent number of hockey-related deaths caused by fighting and bodily contact. In my junior days, I was knocked out after hitting my head on the ice and could only see halfway across the rink. After sitting out the rest of the period, my vision came back and was able to finish the game. If we knew then what we know now, I would not have been allowed back on the ice, and that's for sure. Between the ages of 55 and 79, I passed out 4 different times. Twice after playing old-timers hockey. The last time was while driving home after the game. After numerous tests, they couldn't come up with a reason why I was passing out. I can't help but feel that I had something to do with that concussion. I gave up playing hockey after that last time. I passed out and had been okay since, touch wood. So it's very, very important, as I said, in the old days they just didn't know, but now we know a lot better. We really have to take care of our kids, take care of our athletes, take care of yourself if you're in the sports. This was helpful, so here's some key things to remember. Seek medical attention if your symptoms are persisting, obviously. Even though they say there's no specific treatment for mild concussion, a lot of what you just heard tonight is a lot of sort of groundbreaking different things that's not really in the mainstream. So once again, keeping the mobility of the spine, helping with Jonathan, helping cranial molding and the fascia release, so everything is actually moving properly. That can help stimulate the brain and keep it healthy. Doing the chiropractic, the functional neurology, the way we do it, and putting in things. Putting that all together, even though quote-unquote it's not a proven method, it's actually the physiology and all the help behind it is very, very important to keep your brain healthy. And a lot of the information I shared, I just know that's not usually shared, or people don't know about a lot of that stuff. So you actually want to allow sufficient time for recovery. So take care of yourself, that's the most important thing, okay? So once again, this has been Dr. Marco Caravaggio, Brain First Chiropractor, Jonathan Meister. This is Jonathan's website, jonathanmeister.com. My website, you can go to drmarcodc.com. If you have any questions, please feel free to email the office. You can email it to info@networkfamilycarecenter.com. Center is spelled ER at the end. You can also go to Jonathan's website. He has a contact form there. You can contact him as well. So I hope this was very helpful. Appreciate your attention, and we look forward to seeing you. If you would like an appointment at the office, please call the office. It's 905-477-8900. I could do the baseline screening, and that's a very important thing we can do. And actually, there's a lot of other instruments and techniques that we use to just generally test the health of the nerve system in the brain before people hopefully get into their sports, and that way at least we have baseline measurements. Watching this video, hopefully it was helpful, and we look forward to seeing you in the future. Thank you.